Now, women go through cyclic bleeding beginning from the teen years to the middle and to the old age. To some, this may just seem as a normal part of life, but to others, this experience comes with a lot of, it's very disturbing and it's usually unpleasant. Now, do we even know how or what women go through during these episodes of bleeding and why? In studio, we have Dr. Maureen Owiti, who will be just helping us to unlock some of the challenges that come with bleeding for young people, for the old, and also what causes the abnormal uterine bleeding. Please just talk to us. Our Twitter handle is at Ebru TV Kenya, the hashtag #MyDoctor. You can also talk to us through our SMS platform, which is free of charge, 20268, or simply call us live through the number that will be displayed right at the bottom of your screen throughout this show. But just before I could ask you to sit back, relax, and learn from this exciting show ahead, let's have a look at what's coming up.
Yeah, there's some people who get recurrent yeast infections after their menses. Some get it just before, but majority get it immediately after their menses. And this is usually just due to the changes, the hormonal changes during the menstrual cycle that affect the vaginal pH, which changes the vaginal flora or the normal organisms that grow within the vagina. And this is normal. Treatment is just a long course of antifungals. It sorts that out well. PMS stands for premenstrual syndrome, and this is found in some people, especially when they're just starting to have their menses. Yeah, around the age of 17, 16 to 20 over there. And what happens is that these patients end up getting some other symptoms that they may even think that they are sick, but it's mainly due to the menses. Things like headaches, severe abdominal pains, leg pains, breast tenderness, and with time people grow out of it. Although if it really takes a while, or if it's really not making you be able to perform your daily functions, at times we may end up having to even put you on daily pills, oral contraceptive pills, to kind of reduce the symptoms. Basically, for menstrual hygiene, it's mainly poor hygiene is mainly noted in people who use tampons, and by that is how you handle the tampon. Whether you use clean hands, how you store the tampon. If you store it maybe in a place that's a bit moist, it can end up making you get some infections, either recurrent yeast infections or even at worst a condition called toxic shock syndrome that can even kill. So basically, you're supposed to use the tampons as directed by the manufacturer, including how you store it. You should really take care of how you store your tampons. Yeah. As compared to other contraceptives, the daily pill actually makes one's menses very regular in most people, although you can never predict how your body will respond. There's some people who, when they're on their menses, they end up getting recurrent or abnormal bleeding in between their menses. But for majority of people, even when someone has issues with their menses, like prolonged menses or unreliable and basically a disorganized cycle, you put them on the pill to regulate the cycle. Yeah. I wouldn't worry about menstrual cycle irregularity unless if it's making you have difficulty conceiving or making you bleed more number of times than usual to an extent that you're even getting low blood levels. It's just all about your hormones and your genetic makeup. I wouldn't worry about it, but if someone is worried about it, you can put the patient on pills, on the daily pills, to try and correct that.
And to help us learn more about what Dr. Robert Abade is telling us, in studio we have Dr. Maureen Owiti, who is a gynecologist, and she will be helping us unpack all this. Remember to talk to us. The SMS line is free of charge, 20268. You can also call us live through the number 0791478990, or talk to us through our social media platform. On Twitter, we are at Ebru TV Kenya, and the hashtag #MyDoctor. Welcome to the show, Dr. Maureen.
Thank you very much, Purity. Always a pleasure to be here.
Thank you so much. And maybe we could start with the basics. We could start with menarche, what menarche is.
Okay, that's a very interesting question. I always love doctors. I think we're like lawyers. We have just big terms to explain very simple things. For us, menarche is very simple. It's just your first period.
All right.
So for most women, it occurs in their early teens. So that's 13, 12, thereabout. However, you find some people do undergo it much, much earlier. That I think from about 7 years, I think that's the youngest person recorded to have their first period. And for some people, it can be delayed. So definitely anybody who's over 16 and has not yet had their first period, we're going to consider they're having a delayed menarche.
Okay.
Yes.
And you've talked about different age bracket, beginning from, you said 11 or 12, but what are some of the, do we have factors that contribute or that can predetermine when you will have your first menses?
I think mostly it will be genetic, and it also, there's some element of what we call constitution. So constitution is like things like weight. So you find in obese or somebody who is a bit more healthy than the rest of us, their periods could actually start much earlier. And you find a very, very thin person, and these we say thin, I say like people who are having actually diseases like anorexia or bulimia, their menstruation can be delayed. Even people doing sports at very competitive levels, and and again are underweight because of the amount of exercise and stuff that they're doing, you find that their periods can actually be delayed. But for the majority of us, it's constitution is just genetic, and it's something that tends to happen like that. But the average age, as I've said, is just between 10 and 14. We have the ranges, and we've said what is very early. Early menarche and delayed menarche. Okay.
And Doc, do we have treatment for someone who is having a delayed menarche?
Definitely. If you have a delayed menarche, one treatment, like everything else, is going to depend on the cause, because causes for delayed menarche are several. So someone would really have to first find out why is the menstruation delayed. So you'll find in a lot of cases we'll start simply by just doing their hormones to find out. So you find people who have deranged hormones, specifically something like thyroid, prolactin. And also if we find that the hormones are within normal, we again now start looking for genetic causes. So we have diseases like Turner syndrome and stuff like that, whereby the woman may not even get her menstruation, or it can be delayed.
Right, and just in case you're joining us for the very first time, my name is Purity Museo, and you're watching My Doctor Show. Today we're talking matters menstruation, what happens, what are some of the challenges, especially when it comes to abnormal bleeding or uterine bleeding. Talk to us. The SMS line is free of charge, 20268. You can also call us through the number 0791478990, and in studio we have Dr. Maureen Owiti. Or is it Owiti or Owiti? Owiti. All right, so let's get now to the menstrual cycle. What exactly is menstrual cycle? Take us through what happens in the body, in a female's body, and what all is about.
Okay, I think 50% of the population, okay, slightly under, considering that some people will not have started their menstruation, being women, are people who are going to undergo menstruation or menses or the menstrual cycle. So the menstrual cycle is just what we say, from the start of one period to the start of the next period. And I think also I'd really like, I think as doctors we're crazy, we'll ask you when was your last menstrual period. So a lot of people get confused and they start telling us the last day of the menstrual period. What we're saying is, when was the first day of your last period? So we have a period. The period is when you're actually bleeding. Right. And I had an interesting professor who used to say that the bleeding is the uterus weeping, it's crying, it's disappointed, that's why I'm anti-pregnant, and that's what he calls menstruation. So I really found that analogy very, very interesting, that the uterus was crying, because we know the womb, the function of the womb or the uterus is to bear children. So when it is not doing that, you get a period and the uterus is crying.
Okay.
Yes. So we get a period. For most people, you find a period would be something, anything between 3 to 4 days, max, say, a week or so. We have some lucky people who have periods just for a day. We thank God for them. I get upset when somebody tells me they only have periods for a day, because I'm those who have a longer cycle personally. Then again, we look at it. A normal period would be something like I said, 3 to 5 days, up to 7 days. And then we have what we call a normal flow. So I think Dr. Abadi was talking about use of tampons. So I think for among feminine hygiene products, we can either use a pad or tampons. I think for ease of reference, most people will be familiar with use of a pad. So it's somebody who would change maybe 3, 4, 5, max 6 pads in a day. So you're going to bleed for about, say, 3 days to a week, and you'll change on average 3 to 4 pads. You'll have heavier days where you're changing 5 to 6 pads, but usually those are just 1 or 2 days. And then the other days you find that the menstruation will be lighter. So anything that is either, especially for us, abnormal menstruation would be something that is outside, as in it's more than that. So you're bleeding for 10 days, 2 weeks, and you're changing, like, say, 7, 8, 9, 10 pads per day. And when I say changing, they must be soaked. It's, some people, they don't like to have, they want to be clean, so maybe just has a little stain and they'll change. So they tell you they're turning 10 pads, but just slightly stained. So we're talking about fully soaked with blood. And again, we know that the menstruation is heavy, especially if the woman is having clots. So if the blood is having clots, again, that's a signal that maybe this bleeding is more than the ordinary, because the normal menstrual flow, actually the uterus has what we call an anticoagulant. So an anticoagulant is something that stops the blood from clotting. So a good menstrual flow should not have clots in it. So when you see that you're changing fully soaked pads, 8, 9, 10, and you're getting clots, then maybe you're having some abnormal menstruation. But for the time being, we're talking normal. Then we have what we call the cycle length. So we've talked about the period and the period length. We now have the cycle length itself. So I think the traditional textbook, everyone knows 28, the one we're taught in primary school and high school. Here in the they can remember. But a normal cycle is anything from 21 days, so that will be the shortest normal cycle, up to 35 days. So if you're having a cycle of 20 days, I'd consider that to be abnormal. And again, the cycle is from the start of one period to the day before, because we can only reference when you start your next period. So it'll be that period from when it started to the day before your next period.
And Doc, maybe we could talk a little more on the misconceptions for menses, because for some communities it has been referred as a dirty affair, you know, maybe to make us understand how normal is this and exactly what happens, so that some of the misconceptions that come with the menses.
I think some of the things are cultural, and I think, like, for example, in some of, like, the Muslim communities, you find even they cannot go to mosque on certain days. But I think also, if you look at it, was also a way of the community also helping these women, because sometimes they're undergoing a lot of discomfort. And if you look at right now, at least, we are so lucky, the age in which we are living, whereby we have a very wide range of feminine hygiene products. I'm just trying to imagine somebody 200 years ago, what were they using to help with this flow? So maybe it was some piece of cloth. I hear some communities used to dig a hole and sit on top of this hole. Very, very interesting things. So people may call it that it's dirty, but I think it's just another way of the community trying to just help these women during a difficult time and making their tasks less. People just looking at it as something bad. Menstruation is not bad. It's something that is called physiological. So anything physiological is normal. So it's normal for a woman of reproductive age to have her periods if she's not pregnant in that particular cycle. So I don't think it's anything anyone should be ashamed of. But for someone who has had period, you must understand, I mean, the flow, it's uncomfortable. You have to look for a pad or a tampon, and it comes along. Some people experience cramps, and they can be very severe to the point that someone may not even be able to go to work or do their normal activities because of these cramps. But again, that would now be pathological.
Okay.
Most people will just have mild cramping or no cramping whatsoever during their period.
Okay, and now that you're talking about cramping, can we now have a look at some of the symptoms and signs for menses? Do we have early signs that
Yes.
I think
Okay.
it's approaching that time?
So you find, again, the period, as I've said, I was just putting it a bit layman, but menstruation is a hormonal event. It's a hormonal event. So at any given point in the cycle, you find there's a certain hormone that is leading. Okay? So you find just before your menstruation, you have a lot of progesterone. And what will this lead to? You find some people, you start getting pimples. Some people notice they have pimples before their period. Others get cramps. Others get headache. Others get breast tenderness and things like that. But those are, I think, the most common symptoms people have that they notice. In bad cases, we'll have what we call the premenstrual syndrome. So you'll have really, really awful cramps. You can be vomiting, diarrhea, all sorts of havoc. But again, that's premenstrual syndrome. Again, it's not normal. It's okay. It's happening, but usually it's now taken as a disease entity.
Right.
But for those people having normal, you just notice my breasts are a bit heavy. Maybe there's somebody. I'm expecting some visitors. I think some of us call them visitors. Wageni wamekuja, or your monthly or whatever term. I don't know which terms you're using nowadays as the younger people. Yes.
Okay, and let's get to do we have phases for menses in terms of the age bracket? What we experience as young people, is it the same scenario for older women?
Okay, in principle, the young people, so let's just start a young person who's undergone the menarche.
Right.
So you find the initial cycles may not necessarily be regular because she's not yet established a good hormonal control. You understand? So she may have either too much bleeding or too little and stuff like that. But as she grows, the menstruation will now stabilize and now become what we now refer to as the monthly cycle.
Okay.
And it will be fairly stable. You find for those who have cramps, and we call that dysmenorrhea when you have severe cramps during your period. We have the primary dysmenorrhea, and you find a lot of people with primary dysmenorrhea, once they conceive and deliver their children, for quite a number of women, you find that the pain or during the cramps during the period will either reduce or stop altogether.
Okay.
So you find for some women, and not just some, quite a big number of women, having a child is actually beneficial to minimize these cramps that you're getting during the periods.
Okay.
So we're talking now about an older woman, 30, 40 years, will have fairly normal periods. Then we go to 40, you're now nearing the age of menopause. So you find that you're having fairly normal periods, and all of a sudden the amount starts to reduce and the frequency starts to reduce. So you imagine you're pregnant and you go check, pregnancy tests are negative, they do blood tests, it's negative, because we say any woman who's still menstruating, if she misses a period, we must first think of the obvious, and that is there a possibility of a pregnancy. And you check her hormones and find there's a certain hormone called the follicle stimulating hormone is elevated, and that will tell you that probably she's nearing her menopause. And obviously now menopause is the last period. Unfortunately, in a normal setup, it's what we call a retrospective diagnosis, because we only know you've gone into menopause 1 year down the line.
Right.
So whereby you must have stayed for 1 year without periods for now us to pronounce you to have gone into menopause. But of course it has the other symptoms. I don't know if we'll have time to discuss
Yes, we will. And we're still staying with the irregularities, especially for someone who's just had the menarche phase. And someone is asking, nisaidie, I get my periods twice a year. Maybe, Doc, you could elaborate more. How many episodes do we expect? After your first menses, maybe, how many episodes do we expect them to be irregular? And at what point, now as a doctor, do you expect any person, any girl, to have now stable menses?
Okay. again, I've said that it depends on how old the person is. So if she's an 11-year-old, it's her first period, probably the most important thing would be to just reassure and observe what's going to happen over time. I think by the time she's 13, 14, her periods would be stabilizing and she'll be getting a more regular cycle. But if I'm talking about somebody 18, 20 years who should have had an established menstrual cycle and she's getting 2 periods in a year, that we call oligomenorrhea. So that is somebody who's having very few cycles.
Right.
And that is definitely pathological, and she should actually consult her gynecologist and to really go and delve and find out what the problem is. Yes.
And before we want to talk about the painful period and also the normal period, how it is like. Remember, today we're talking matters menstruation, and this is an affair for women, but you could listen in for your sister or even for your mother and also for your wife. Talk to us. The SMS line is 20268, which is free of charge. Call us live 0791 478 990. Dr. Maureen Owit will be telling us more about some of the diet. Do we have a special diet during menses? Keep talking to us. The SMS line is 20268. You can also call us live 0791 478 990, and we will be glad to respond to some of your concerns. Welcome back, Doc.
Thank you.
Yes, and before we went for that quick break, we were talking about, we want to now have a look at the painful periods and also the normal period. But just before we get to the period, painful period, maybe you could just take us through what a normal period is like.
Okay. So, I mean, for those who have just joined us, I think I just put it that, I mean, a normal period is just when you get the flow, and you should use, it should usually be about 3 to 5, maybe a week.
Right.
And then the woman should be able to use about, change pads during the day about 4 or 5 times, and it should not be very heavy flow. So it's something that it's just a period in the cycle. And then we've talked about the cycle length, that from start to start, it should be about 21 days, between 21 and 35 days.
Right.
So I think you had called about the caller who's having her period only twice in a year.
Yes.
And I'd really advise her to see a gynecologist. Yeah.
And Doc, why do some women have to experience painful periods while others are just having a normal day when they're having these menses? Is it somehow unfair, or what causes that?
Okay. I think it's just life. Not everybody is cast the same lot.
Right.
Yeah. You say, why are others tall, short? Why are others fat, thin?
Right.
Why are others light, dark? And it's just like that. But you find in quite a number of cases, and especially if it's something that's new, if you've been having normal periods and you're not getting a lot of cramping or just some mild cramp, because I think that's what would be normal. You shouldn't have a lot of cramping during the periods. And all of a sudden, you're getting severe cramps. Then it's something that somebody should really look into, that is there some disease happening. I think the worst being endometriosis.
Right.
Now, that's really, it's also, again, something that's hormonal. And these women experience excruciating pain during the periods, and because of the damage it can cause, even outside of the periods, they can be experiencing pain. So during the first periods, like someone's undergoing menarche, it can be expected to get the cramps. And I think we also discussed that once people deliver, people are having what we call the primary dysmenorrhea. Dysmenorrhea is pain during the periods.
Right.
That having a baby can assist. Whereas something like endometriosis, one, getting pregnant can be an issue, and having a baby may not necessarily relieve the pain. So it's really just understanding that for a normal cycle, what should happen should be just some minimal discomfort. If you're having severe pain, please just go see your doctor, especially if you're unable to do your normal activities because of the pain that you're feeling. Definitely that's somebody who needs a review, and needs an evaluation to find out exactly what is happening.
Okay, and maybe Doc, you could tell us what causes the severe pain, because for some women, once you, let's say you're in Nairobi, you don't have much pain, but once you move to a different region, then you're really into pain and you can hardly move.
Okay.
Yeah.
That's also very interesting. And when you'll find that even how regular your cycle is, you find that climate can affect how often your cycle is coming. And even as you said that with the pain, it can be affected. But I'd also look at, I think the clip tried to look at things that would affect your cycle.
Right.
One of the things I find also salt, I think it was not mentioned, but sodium chloride, or the common table salt,
Okay.
yeah? If you take high quantities of salt and don't hydrate well, so I saw the caffeinated drinks.
Right.
And the only way I think the caffeinated drinks would mean that you're not well hydrated. So if you're not well hydrated, and again, maybe in a very, very dry place, all leading to dehydration, you find these can be causing your periods to be more painful. So again, I'd really advise women that if you're having a lot of cramps, some of the things that I would advise initially would be to look at your salt intake, look at how well you're hydrating. And again, everyone always forgets that the good intake is about 2.5 to 3 liters of fluids on a daily basis.
Okay.
I think majority of us, we
not
don't
say-
follow
Yes.
that.
Right.
And exercise. Well oxygenated tissues do not pain as much as tissues that are not well oxygenated. So those are some of the things I'd first modify. As of course, initially, if the pain is very severe, we'd give some initial first aid. But we'd look at, can you reduce your salt intake, maybe reduce your coffee, tea intake, drink a lot of fluid, especially water, and exercise. And you find for a lot of women, without adding a lot of medication, this can actually reduce the amount of pain they're feeling during the menstruation.
Okay.
If that is not working, then we go to other medical ways of relieving the pain.
Okay, and in the second part of My Doctor, we'll be having a look at some of the conditions that may alter your menses. We'll also be responding to your concerns. Then make sure to call us live, because it is the time that Dr. Maureen Owiti will be receiving your calls and responding to them. The SMS line is free of charge, 20268, and the call line is 0791478990. Welcome back. You're watching My Doctor Show, and my name is Purity Museo. Today we are talking about menstruation, and in studio we have Dr. Maureen Owiti, who is just helping us to unlock what it has, or what it means to be, or to have menses, and what are some of the challenges, and also treating abnormal bleeding. Talk to us. The SMS line is 20268. You can also call us live through the number that is displayed right at the bottom of your screen. Welcome back, Dr. Maureen.
Thank you, Purity.
Yes, and there are so many questions coming in. Maybe before we continue, could just take a few.
Okay.
I'm 30 years old now, experiencing dizziness and headaches during my periods. Should I be concerned?
Definitely. The moment she starts saying she's having dizziness and headaches, I would really ask her, how is her flow? Because dizziness, headache is a sign that her blood levels are low. And it can be worsened again. The normal, I remember I've said that they change about 3 to 4 pads.
Right.
During a normal cycle, a woman uses between 50 to 80 ml. So that's just like half a cup. So if you look at it, it's not a lot. It's not a lot of fluid, though it looks, it sounds to be a lot. So by the time she's having headache, dizziness, it means her blood levels are low and her flow is quite heavy. And again, maybe due to fibroids or something like that. So she should have that checked out.
Okay, and one more, kwa menstruation cycle yangu, period, I think it's rare, once in a time. Siku gani ni poa naeza pata mimba? I think she's just asking about how to monitor your menses. Welcome back, and I do understand, Priscilla, you are on the line. Let's pick that call. Hello, Priscilla.
Halo mama, habari yako?
Nzuri sana.
Mimi kizungu sikielewi sana.
Sawa, tuongee Kiswahili.
Lakini nitakuzungumzia Kiswahili kidogo.
Sawa.
Kuna kina mama wanapata tabu wakishika mimba, alafu wanapata monthly period kila mwezi. Hiyo imetokezea nini?
Okay, asante.
Okay, sawa.
She's asking about bleeding during pregnancy, right?
Yes.
Yeah. I don't know whether you should respond in Swahili.
Kwa sababu ameuliza kwa Kiswahili,
Right.
wacha tumjibu kwa Kiswahili. Asante sana Priscilla. Ni kweli kuna wanawake wengine huwa bado wanapata periods ama damu ya mwezi wakati wameshika mimba. Si kawaida. Lazima tumwangalie na tumpige picha kuhakikisha mimba haina shida. Mimba ikionyesha hivyo, kuna dawa tunapatia kuzuia hiyo damu kutoka. Asante sana.
But is there a call for alarm, doc?
Definitely, if you are pregnant and you are bleeding, one of the most obvious things, the first thing that will come to mind to any obstetrician, that you're having a threatened miscarriage.
Okay.
So it's something that if you are aware you are pregnant and you are bleeding, it's a very big cause for alarm.
All right. Okay, thank you for that concern from Priscilla from Mombasa. Maybe, Doc, we could now highlight some of the conditions that may alter someone's menstrual cycle.
Okay. There are many things that can alter the menstrual cycle, but again, the main thing you find is travel and any form of stress. So you find travel would involve a change in climate. So you find you change in climate, it can alter your cycle, it can alter your cycle length.
Okay.
Again, stress.
And just before we get into details, can I cut you short?
No problem.
There's someone who is calling us from Kitengela. Hello?
Hello,
Hello, Maggie. How are you?
I'm fine.
Okay, go ahead.
Okay, nilikuwa nauliza niko na discharge ya wet. Hello?
Endelea, Maggie.
Then najikuna. Then maybe you can having sex is painful.
Okay.
Naenda kwa choo mara moja.
Okay.
Yeah, so nilikuwa nauliza ni shida gani.
Sawa.
Alafu sometimes my period is like twice or twice per month.
Okay.
After 15 days, like I'm like 8:15, then 8:30, then after another 2 weeks inarudi tena. Sasa naweza kuwa na shida gani?
Okay. Thank you so much, Maggie. Asante. She's raised a few concerns. The symptoms that she usually has during her menses, including what I've heard clearly is going to the toilet frequently, and also the period coming more than once in a month. What could be the problem?
You find going to the toilet frequently, if she's going around her period, it could be irritation, and in some bad cases could actually be due to a urine infection. Regarding itching, a lot of women tend to have yeast infections around the time of their period. So again, if you're having pain, stress, you can trigger a yeast infection. So that's probably why she's itching. And that was, I think I had something about itching.
Yeah.
About if her cycle is not regular, that again, people may not understand that I've said a cycle can be 28 days. And I've said it can be 21 days. But it doesn't mean that every cycle, if you have a 21-day cycle, that you're going to have it for 21 days. Okay? So as long as it's something that is, maybe it's 28, it can be 28 to 30 days, that would still be considered a regular cycle. But if you're having, like 1 month, you got the cycle was 21 days, then the next one went to 35, that's definitely an irregular cycle. And the most probable thing is that there's some hormonal imbalance of some sort that the woman is experiencing, and she needs to get a hormonal evaluation to find out what exactly is not happening.
Okay. We also have Valentine from Kayole who is online. Hello, Valentine.
Hello?
Yes. How are you?
Hello?
Yeah, go ahead.
Niko na fistula ya miaka 5 na huwa na bleed after 3 months.
Okay. Thank you so much for your concern.
Okay.
You've heard her clearly.
Yeah. So definitely, we've said the normal length for bleeding would be up to a week. So if she's bleeding continuously for 3 months, that's definitely having a problem. But also, we'd have to go into her contraceptive history. Is she using some form of contraception that could be causing her to have abnormal bleeding?
Yeah. And Doc, maybe just take us through some of the things that may make us as women go through or experience some abnormal bleeding. You've talked, actually, let's begin with the contraceptives. Do they have a hand in this?
Yes. It would depend on the form of contraception that you're using. So if you are taking, say, an combined oral contraceptive, majority of patients, I expect them to have very regular cycles. And we actually use this property in the combined oral contraceptive for people like that lady who's having 3 months. If I can find that there's no physical cause like fibroids or a cancerous growth or something like that, and we can use the pill to help regulate the cycle. But we have other methods like the injection or implants, and these are progesterone only or progestin only. You find women will have different side effects because of that. Some women may not get periods as they're using the injection or the implant, or they may be spotting or bleeding on a daily basis. So that could be a possibility. So I'd really have to take a history, find out, is she on contraception, what type of contraception, could that be what is affecting her? I don't expect major changes from something like a condom. I don't expect condoms to have changed your menstrual cycle. We have like the intrauterine contraceptive device, the IUCD. You find for that, I would still expect you to have cycles like your previous cycles. However, the bleeding can be a bit longer and you can have more pain during the periods and are slightly heavier than flow than normal, but I still expect a cyclic cycles. Okay,
so many requests on menses and ovulation, kindly in details. The relationship between menses, menstrual cycle and your ovulation, because Catherine is asking, how do I count, how do I know my safe days? Please help.
Okay, so safe days are those things of people want to achieve different things. So somebody who wants to achieve contraception would use their safe days. Somebody who wants to get a pregnancy would use their not safe days. Okay. So I think also your producer was asking about the luteal phase and follicular phase.
Yeah.
So let's just start that it's today, I think is the 2nd, my period has started today, and I'm going to bleed for 5 days. At this particular time, I'm going to be in the follicular phase of the cycle. So at this point, we have an egg or several eggs. There's a hormone called the follicle-stimulating hormone that's going to be secreted, and it's going to make what is going to get ovulated to grow. And it becomes a cyst that will be filled with fluid, and that's the work of the follicle-stimulating hormone. So we call that phase until the woman ovulates, the follicular phase of the cycle. Then, due to some hormonal changes, there'll be a pulse, the hormone is going to shift, we're going to have what we call an LH surge, and the woman is going to ovulate.
Right.
And this LH surge, you'll find LH is the luteinizing hormone. It's again preparing the woman for pregnancy. And we actually use that to check in the urine if the woman has ovulated. So if you have an LH surge and you don't intend to be pregnant and you do an ovulation detection kit, definitely these are days when you can get pregnant. The woman ovulates. Once she ovulates, you find that if she's going to conceive, the pregnancy cannot sustain itself for some time. So where she has conceived, there's kind of like a hole or a defect left, and there are going to be some hormonal changes there.
Okay,
and you're going to have
just before we get through to the whole cycle, can we receive one more call?
No problem.
Okay, Carol from Nyeri is calling us. Hello, Carol.
Hello?
Hi, how are you today?
Fine.
Okay, go ahead.
Nauliza. Nikiwa na periods.
Oh, we've lost Carol, but I'm sure she's going to call back.
Okay.
Let's continue.
So, I think I can just continue where I left off.
Yes.
So the time between the woman has ovulated till the time the woman gets her next period is now what we call the luteal phase of the of the cycle.
Right.
Okay, so hormones are going to be secreted, and these hormones actually help sustain the pregnancy before the fetus is implanted and the placenta takes over the function for nutrition of the pregnancy.
Okay.
So that's the difference. So we have between menstruation and ovulation, that's the follicular phase, and then between ovulation and the next menstrual cycle, that's the luteal phase of the cycle.
And I don't know whether Carol is back. Okay, she's not back yet.
Okay.
All right.
So now it's again understanding that there's several things that are going to be happening at different phases. So stuff will be happening at your brain, the ovary, and then the uterus. So you find in the follicular phase, we've said also in the ovary, the egg is going to become bigger, become a cyst, and then it's going to ovulate, and you'll be left with a defect that will now form a different cyst that's called the corpus luteum. On the uterus, you find the follicular phase. When she has had her period, the lining has shed off completely. It remains very, very thin. Now, the uterus, the baby cannot implant in a thin lining. So during that phase, the lining is going to increase to prepare for implantation of the fetus.
Right.
And during the luteal phase, it's just those changes so that vessels are getting ready for implantation of the fetus.
And so now Carol has dropped her question. She was asking during her menses, she usually feels some lump on her breast. Is it normal?
Yes, because remember I've said that before menstruation, you have the influence of progesterone. So there are several hormones at play. So I've talked about the follicle-stimulating hormone, luteinizing hormone, progesterone, estrogen. All of those are in play. So just before your periods, you have higher levels of progesterone. And because of these levels of progesterone, you feel that your breasts are heavier and you get these lumpy changes, which is also why we really advise women that if you're going to be doing a regular breast exam for checking for breast cancer, you should do it away from your periods, because there are those changes that are going to occur in your breast around the time of your periods.
Okay, and someone now is asking, for a woman who has regular cycle, what are the safe days for that woman?
Okay, so let's just go to the traditional 28-day cycle, because I would say it depends on how long is the woman's cycle.
Right.
So it's very important to know how long your cycle is. So if I take the traditional 28-day cycle, we'll know you'll ovulate around day 13, 14, okay? Day 14 of the cycle. We also know that sperm will stay alive in the woman's reproductive tract for between 72, maximum 5 days. 72 hours is 3 days to 5 days, but on average is 3 days. So if you're going to ovulate, say, on day 14, 3 days prior to that, that will be, say, day 11. So you'll find that the window of day 11 to day 14, those are very unsafe days. But because there are sperm that can stay up to even 5 days, you find that you'll be safe immediately after your periods till they're about day 9, day 10 of cycle in somebody who has a 28-day cycle. After ovulation, the egg will only stay alive for 24 hours.
Right.
So that'll be day 15. So safely, if you add, again, shifts, it's not that, because it's not exact that because you have a 28-day cycle, you're only going to ovulate on day 14. We expect to ovulate around day 14.
Okay.
So give or take another 2 days for error in when you'd say 5 days, the window of 5 days before and after your menstruation. So any day away from that would be a safe day.
Okay.
So just before your period, obviously, would be a very safe day because it's unlikely that you can conceive at that time.
Okay. One more question. How do you calculate safe days? I think you've already talked about that. Hello, is it okay to have breakouts around your groin area before and after your periods?
Okay. Again, this is somebody I would ask if what method she's using to remove the hair in that, we call that area the perineum, okay? And yes, it's normal, just when you get pimples on the face, you actually can get those breakouts in that region.
Okay.
Yes.
And what is the cause and remedy for severe menstrual periods? I think you talked about that,
so
but the remedy?
if it's not pathological, I think we talked about the natural ways.
Right.
And I think also they've added other interesting herbal ways. I'm not a herbalist, so I just deal in whatever.
Right.
But again, just have an evaluation to find out. Start with those simple measures, and we'll just look into it to find out what exactly is the cause of the pain. Because if it's endometriosis, we're going to treat for endometriosis.
Okay.
If it's fibroids, likewise.
Right, and Sharon is calling us from Migori. Hello, Sharon.
Hello.
Hello, hi.
Hi.
Okay, go ahead with your question.
I'm asking that under my period,
Yes?
I always overbleeding. Sometimes I can use five. Pads in a day, and they are all full.
Okay.
So when I went to the hospital, I discovered that I had the doctor wrote down that I had yeast.
Right.
So then they wrote for me there is a certain medicine. It was called Docbactam. So I was just asking if this thing can affect my baby.
All right.
Yeah.
Thank you. The issue of heavy bleeding, it's really disturbing.
Okay.
Yeah.
So again, I'd say unless her cycles, she was having less bleeding, for me, 5 pads changing in a course of 24 hours would still be a normal flow. Maybe due to her other symptoms, it sounds like the medication she was given was for a yeast or a fungal infection.
Right.
And I didn't understand, because for her to be having that flow, most probably she's delivered, so she's worried about breastfeeding. Majority of the drugs we give somebody who is breastfeeding would be topical and should not affect, or local, should not affect the baby. And again, also, even the oral medication, I think the most common that we use is fluconazole. Fluconazole would be a start dose, as it's just once, so I don't think would have high enough levels in the breast milk that would affect the baby adversely. Yeah.
And Anne from Thika is asking, is it right to have intercourse during your menses? And just before you answer, Anne, we have someone who is calling us again. Hello? Hello?
Yes.
Hi.
Hi.
Kindly tell us your name and where you're calling us from.
Naitwa Iligista from Kakamega.
Haya.
Nilikuwa nauliza huwa natumia family planning.
Okay.
Nikitumia huwa na stop my period.
Okay.
Na nikiacha huwa zinakuja daily hata for 3 months mpaka niende tena. Naweza saidika aje?
Asante. Doc.
Okay. I think for her, she has reached a level whereby she should not be followed up in a clinic, because she just sounds like she's going to a regular clinic, and people actually have to find out what is the cause of her bleeding, because it's not normal for her to be bleeding. We're just treating the symptom. We have not found out what exactly the cause of her issue is. So if she can just see her gynecologist, I know my colleagues are there, many of them in Kakamega. Yes. Now, I think back to the other interesting question about taboo and sex and intercourse during menstruation. This is something I think I leave to somebody's person. People are different, but I think majority of us, and especially us as Africans, we really don't consider it a good thing to have intercourse when somebody is menstruating. It's also remembering that you have a raw area. It's somewhere that's bleeding, it's like there's a wound. So you find at this time you're more susceptible to infections, and especially things like the STIs, because it's a raw wound. So if at all, definitely I would hope that some level of protection is being used, but it's just on somebody's sexual orientation and preference. I would not. It's not a moral question. Yeah.
And Elizabeth from Eldama Ravine is calling us. Hello, Elizabeth.
Yes, hi.
Hi.
Okay, niko na swali. Okay, since nilijifungua 5 months ago.
Okay.
And sijapata period na situmii family planning. Naweza conceive tena?
Okay, asante.
Yes, that's a fairly simple question. So she's actually practicing contraception without realizing. We have what is called lactation amenorrhea method, or LAM. And you find that a woman who is exclusively breastfeeding, because we are advising all our women to exclusively breastfeed. So that means for the first 6 months of the baby's life, the woman only gives her baby breast milk. She doesn't give water, porridge, nothing. And you find a lot of women, their periods don't come back when they're doing that. So as long as she's exclusively breastfeeding and her periods have not come back, it is a form of contraception. Once she starts weaning the baby, you'll find that her periods should come back and it should not be anything to cause for alarm. You find that once she has weaned the baby and her periods are not resuming, then maybe it's a cause for alarm. She can go to see her baby. So maybe like within a year, you should expect that her period should have come back.
And because we have to wind up, Doc, is there a way you can give our viewers your contact details in case they want to contact you in person?
In case they want to contact me in person, so I'm easily found in, I work also at Kenyatta National Hospital, but I also have a private practice at 40 Suits. That's on Hospital Road, and our clinic is called Gynacare.
Okay.
Yes.
Thank you so much for your time. Thank you so much for coming to my doctor show.
Thank you so much.
Yes, we've learned a lot today.
Awesome.
Yes, and thank you for watching our show today. Thank you for your feedback, your questions, and your calls. We do appreciate. My name is Purity Museo, and as always, you can download our previous episodes from our YouTube channel. Just go to Ebru TV Kenya and Purity Museo and look for the episode of your choice, including today's episode.